So again, welcome to our Help to Hold community resource webinar series hosted by the Ocean Monmouth Health Alliance. My name is Jenna Sistad, and I'll be introducing our speaker today. Just so everybody knows, this is a webinar series we've been promoting since the start of the pandemic. This year, we will be hosting and highlighting our community partners and the great work that they are doing in Monmouth and Ocean County. And we will be celebrating and raising awareness about each of the cancer and chronic disease prevention months. This month is Cervical Cancer Awareness Month, so that is the topic we will be highlighting. And we have our friends from CHEMED in Lakewood joining us for the session this morning to be our presenter. So thank you so much, everybody, for joining us. And I'm going to turn it over to Walla. Thank you, Walla.
Thank you. Good morning, everybody. My name is Walla, and I currently am the front desk supervisor at CHEMED Health Center. CHEMED Health, has been around now for 13 years. It's considered the largest healthcare facility within New Jersey. We were founded in 2009, and we provide a amazing service here for all of our patients to provide preventative treatment, healthcare, education, and we selected our team specifically to help all different types of patients from all over. We currently have 3 locations. We have our main building, which is located at 1771 Madison Avenue. Then we have our MyCare Westgate. And then we have our mobile unit, which is a mobile unit that we use to travel all around Lakewood to help give preventative care, educate our patients, and so on. We currently are working on 2 new sites, one which hopefully will be opening soon sometime this year, CHEMED South, which is located at 1171 River Avenue. On the border of Jackson.
Very nice.
Yeah, so it's up, and hopefully opening date will be soon. We also have our Jackson facility as well. We're looking to open it up late this year or even maybe early next year. But hopefully that will also be up and running in Jackson as well on Hope Chapel Road. So like I was saying previously, we are located in Lakewood, and our main population is Orthodox Jewish and Hispanic patients. However, we are very culturally sensitive because we understand there's all different types of cultures, and we try and accommodate all those cultures and being culturally sensitive to all our patients. We use translation lines when needed. We have them on our iPads now. We have them on laptops. For any patient that needs to come in, we use our translation app. We offer financial assistance for any patient, regardless of immigration status, regardless of if you do have insurance. We do have a sliding scale aspect of it where it's based on a discounted rate for our patients. So income-based, we can provide you with a sliding scale or put you on emergency Medicaid. We also offer a variety of different facilities here, or different departments. We have our pediatrics department, internal medicine, geriatrics, women's health. We have behavioral health, dentistry, and fast track, which is like our urgent care. We have our own radiology department here where we take x-rays. We have pharmacy, and then specialties like podiatry. We have pediatric specialties for endocrinology. We have cardiology, all these different specialists that come in from our Robert Wood Johnson to help service our patients. We have our case management department who follows up with our patients. Sometimes geriatric patients or sometimes our patients don't go to the specialties that they need to go to. So we make sure our case management department is able to follow up with them, make sure they get what they need done. We also have our social services as well. So our social service division, the Lakewood Resource and Referral Center, helps our patients with senior benefits, rental assistance, childcare benefits, all these different things. Like I said, we're kind of really trying to help anyone in our community as much as possible, holding their hand, making sure they get what they need done for life, everyday life kind of a thing. LRRC department helps our patients have insurance as well. So they'll help you apply for the insurance, follow up with you with the insurance. And so open enrollment right now is open until January 31st, 2023. And you could always give them a call or follow up at their website to help, to help finish open enrollment with them. LRRC also has NJ state cash benefits programs. The state of New Jersey offers cash benefits if you stop working to care for your own or loved one's physical or mental health, care for yourself during a pregnancy or childbirth recovery, bond with a new child, and cope with domestic or sexual violence. And again, their information is at the bottom of the slide where you're able to give them a call or go through their website and get in touch with somebody. This is just their information, just once again, and they're located at 212 2nd Street, Suite 204 in Lakewood. And if you have any questions, you could always email them to questions@lrrcenter.org. Alrighty. So what is HPV? HPV is a common virus with several variations, some of which can lead to cancer. It is spread through close contact and can be spread even when there are no signs or symptoms. In fact, HPV infections often do not have symptoms and therefore are not discovered until later on as developed. HPV is very common, so common that almost every sexually active person will get HPV at some point if they do not receive the HPV vaccine. Although there is no treatment for HPV, there is treatments for the health problems that it can cause. There are many cancers that can be caused by HPV, and they often take years to develop. Today, we will be discussing cervical cancer specifically. More than 9 of every 10 cases of cervical cancer are caused by HPV. Almost all of these cancers can be prevented by the HPV vaccine. Cervical cancer is most frequently diagnosed in women between the ages of 35 and 44, which is the average age of diagnosis being 50. It is recommended that women receive regular cervical cancer screenings, which help to identify precancers that can lead to cervical cancer. Current guidelines for cervical cancer screenings are between 21 to 29 years of age. A pap smear is conducted every 3 years. Between the ages of 30 to 65 years, a pap smear can be done every 3 years. FDA approved HPV testing every 5 years and co-testing every 5 years as well. For anyone over the age of 65, no screening is required if they had a negative screening result previously. And then if they've had a hysterectomy or the removal of the cervix, there's no screening needed. So the HPV vaccine, the good news is that there is a safe and effective vaccine, Gardasil, that protects against 9 types of HPV infections that can cause cancer. The CDC recommends 2 doses of HPV vaccines at age 11 to 12, but can start as early as 9 years. 6 to 12 months apart, those starting the vaccination course between the ages of 15 and 26 are recommended to receive 3 doses. And below you could see a chart that just, reiterates again those ages. So for CHEMED, it's very important for us. We have our own women's health department, and they're happy to do to make sure that you're up to date on your cervical cancer screenings and HPV vaccination. To set up a consultation appointment with the physician, you just have to call our main number, which is 732-364-2144, and just create an appointment. They'll review your medical history, determine if you need a screening, and can ask questions. You're able to ask as many questions as you like about the screenings or the vaccination before you receive it. We offer cervical cancer screenings through the Women's Health Department, as well as internal medicine or fast track if symptomatic. So if a patient comes in and they're like, I'm experiencing symptoms or whatever the case, we will do a pelvic exam as well in our internal medicine fast track. So it doesn't have to just be Women's Health Department, but our women's health physicians, our OB, our GYN, and our midwife are very valuable in their knowledge. So if a patient does want to come in and just have a consult with them, more than welcome to. If you are getting a screening at CHEMED and the physician has concerns, they will call you to review your blood work and order your blood work as your pap smear. They'll review all of that with you. They will order more blood work if needed and review that for your partner as well. Screenings at CHEMED through NJSEED. NJSEED offers free cervical cancer screenings to uninsured CHEMED patients who are at below 250% of federal poverty level. To apply, you'll fill out the application with our financial assistance department, our women's health department, or you can fill out a consent from CHEMED to, to perform the screening. Thank you, everybody. And that's really the presentation in a sense. If you have any questions, please let me know.
Thank you, Wala. It was such a great presentation, not only about the programs and services that CHEMED offers, but to talk a little bit about the cervical cancer prevention, which is why we talk about HPV and the vaccine. I'm really glad that you mentioned SEED because we do have a representative from the SEED team here today. I don't know, Raven, don't feel like you have to take yourself off mute, but if you wanted to give a little introduction about yourself and what you do, certainly we welcome that on this platform here.
Hi. Yes, hi everybody. This is Raven Gates from the SEED program. I'm the marketing and outreach manager. That was awesome information that was shared. Thank you for putting our information out that's being shared to the CHEMED patients and those are on the call. But we do cover not just cervical, but breast, colorectal, and prostate for those in Monmouth and Ocean County if they're uninsured between the ages of 21 to 64. So yes, the information is correct, but the other services we do provide. So if anyone has any questions or looking to get more information for those that they know in Ocean County or other partners, I'll put my information in the chat.
Excellent. Thank you, Raven. I do have a couple of questions for you, Wala, about some of the things that you talked about, but I'll open the floor up to the other participants first. It's a manageable group today, and we are ahead of schedule, which is wonderful. So if you want to take yourself off mute and ask any questions, please feel free to do so now.
I do have a question. I think the services are great. I love everything that CHEMED offers. On the other websites, I've noticed that you guys also offer budgeting and nutrition and all the great things. So yay, CHEMED. I'm a big fan. But do you guys also provide enough staff that speak Spanish? Primarily Spanish. I mean, I know that you have, I know that there's Haitian Creole as well community, but specifically in Lakewood, there is a large Latino community. And do you offer anything for them to do online in Spanish? Because I think some of them are pretty savvy with their phones and could probably set up an appointment or, do things online if available in Spanish.
Yes, so we do pride ourselves on we do have Spanish speaking employees in each department, make sure that that we're able to communicate. If not, we always do grab somebody from case management to women's health. Everyone, there's at least 2 to 3 employees that do speak Spanish in each department. And online wise, we actually recently made our financial assistance through a QR code, and that's in Spanish. So, we have Spanish, Hebrew, and English. So patients, when they come in, we have iPads here, or they could do it online. We'll give them the website. They're able to scan it and do it themselves. And they're able to apply with it in Spanish. If they're doing online, it's through their portal, and their portal does have a ability to, have it in Spanish as well.
Excellent. Okay, that's my only question. Thank you.
I have a question. You mentioned that you have a mobile unit. I didn't know that. Is that something that it's just for CHEMED, or is it something that we would be able to invite you to if we have a outreach event?
So we do use it for outreach events and stuff. We've been recently using it for COVID vaccines and so on. But of course, if you did have something like that, I would say send your information to Emily Morales. She's actually on the call with us, and she'll be able to coordinate, what the outreach events that you have and when we could use the mobile unit.
Absolutely. Yeah, I'll put my information in the chat.
Thank you, Emily. And also, what kind of services do you provide from that unit?
So like I said, because of COVID, we recently started using it for a lot of our COVID vaccines, flu vaccines, and things like that. But beforehand, we used to have a provider that would be there and, do fast track, urgent care kind of visits. So if they were doing like strep cultures, things like that, I'm sure that, again, depending on what you need it for and so on, we could always coordinate something and be able to use it for what is necessary.
Thank you very much.
Of course.
Great connections being made here today. This is awesome. Does anybody else have questions? Do you want to take yourself off mute and ask, or you could certainly put it into the chat? Okay, I'll ask my question. So you mentioned a lot of different services that CHEMED offers. First thing I was going to say is, can you go back to the financial assistance slide? Because I was able to write down the phone number and the email, but I just missed the extension there.
Not a problem. There it is.
Excellent. 3-2. And then along the same lines with all the wonderful services that you offer, I know some health centers require you to become a primary care patient before they will provide a specialty service to you as a patient there. Is that the same case with CHEMED? Do you need to become do you need to like be seen by a primary care provider first, or can you skip right to a specialty service with a referral from your own respective primary care provider?
So as long as you have a referral from your own respective primary care, and depending, of course, on your insurance, like United Healthcare, they need an online one and so on. You don't need to see a primary care doctor here. No, you can come in with your own.
Okay, so let's say I'm an undocumented patient that doesn't have any insurance, but I can show my income through like a letter or whatever from my employer. Am I still able to have it the same way?
Yeah, so we would just essentially tell you you're booking your appointments. You have to come in 15 minutes early before your appointment just to speak to financial assistance, or if you do the application online, you could just come in. We'll take the incomplete slide, we say, until your documents are reviewed with financial assistance, so your letter, whatever the case may be. And we'll take that $25 and you'll finish the process with financial. And once that's done, not a problem. You can go ahead and do whatever you need to do. You can come back. It doesn't have to be just for specialty. We'll tell you to come back and use something else in our facility if you'd like, or you could just use it for specialty. It's up to you.
Wonderful. That's great. That's a really nice perk. Okay. All right, I'm going to do a last final call for questions before I wrap us up and give a few Ocean Monmouth Health Alliance updates. Does anybody else want to ask a question of Walla or Emily? Okay, excellent. So thank you again, CHEMED. Thank you, Walla and Emily, for doing this with us. It's really important that we highlight Cervical Cancer Awareness Month, and what a better way to do that than to explore the services that you offer surrounding those important topics. So thank you, and thank you to all the participants. A few Ocean Monmouth Health Alliance updates is just that our next meeting like this, where we will do education around American Heart Month in February, will be on February 22nd at 10 a.m. Our highlighted presenter will be from Central State's team, which is wonderful. And the other thing to note is that Ocean Monmouth Health Alliance has quarterly meetings where people can connect. You'll hear updates about the things that we have going on with partners throughout Monmouth and Ocean County, different events, awareness activities, some of the navigation that Diana and Marlene do. So that's a great place to be, to connect with many other providers. We have hospital systems, we have FQHCs, we have you know, the Cancer Institute of New Jersey, SEED is there, lots of other community-based partners that are on. We have survivors that are there, and it's just a great place to connect and learn about different programs and services. So the next meeting like that will be on February 8th at 10:30 a.m. That's also going to be virtual. So more information to come. If you do not already receive our e-blast, please put your name and your email address into the chat box, please, so that I could add you to our distribution list. Oh, wow, you're getting a lot of praise and thanks in the chat box. I'm catching up now. People are saying this is great presentation and services. Thank you. Great information, CHEMED. Thank you. So I echo all that sentiment, and I appreciate you guys being here with us today.
Thank you so much for having us. It was great. Thank you.
Okay, everybody. Well, thank you for joining, and we're going to conclude today's session. Enjoy the rest of the day and be well.
Have a great day, everyone. Thank you.
Bye, everyone.
Thank you.